Can you perform cardiopulmonary resuscitation on a child through clothing? Can you perform CPR on a child through clothing? Option A, yes. Option B, no. The correct answer is option A, yes. Clothing doesn't prevent effective compressions. So they can give CPR on clothing. If a child has a foreign object blocking airway, what should you do first? Option A, start CPR. Option B, perform abdominal thrust. Option C, give rescue breathing. Option C, wait for help. The correct answer is option B, perform abdominal thrust. Clear. What should you do if the child becomes unresponsive after choking? Option A, continue abdominal thrust. Option B, start CPR. Option C, only call EMS. Option D, give water. The correct answer is option B, start CPR. Unresponsive choking victim requires CPR immediately. How do you check pulse in an infant? Option A, radial artery. Option B, by carotid artery. Option C, brachial artery. Option D, femoral artery. The correct answer is option C, brachial artery. Use brachial artery inside upper arm for infants. Use brachial artery for infants. Should you allow full chest recoil in child or infant CPR? Option A, yes. Option B, no. The correct answer is option A, yes. Proper recoil improves blood flow during compressions. Proper recoil improves blood flow during compression. Can you perform CPR on a child with a pacemaker? Option A, yes. Option B, no. The correct answer is option A, yes. Safe to perform compressions, avoid direct pressure on device. Safe to perform compressions, avoid direct pressure on device. How long should you check for breathing in a child or infant? Option A, 5 seconds. Option B, 10 seconds. Option C, 15 seconds. Option D, 20 seconds. The correct answer is option B, 10 seconds. Do not spend more than 10 seconds. Do not spend more than 10 seconds. For how many rescuers are ideal for infant CPR? How many rescuers are ideal for infant CPR? Option A, 1. Option B, 2. Option C, 3. Option D, 4. 2 rescuers allow 15:2 compression to breath ratio for optimal oxygenation. Which part of the hand do you use for 2 rescuer infant compressions? Option A, 2 fingers. Option B, thumb encircling technique. Option C, palm. Option D, whole hand. The correct answer is option B, thumb encircling technique. Thumb technique provides effective compression while supporting chest. How often should rescuers switch during child or infant CPR? Option A, 1 minute. Option B, every 2 minutes. Option C, every 5 minutes. Option D, never. The correct answer is option B, every 2 minutes. Switching prevents fatigue and ensures effective compressions. How does AED stands for? Option A, automated external defibrillator. Option B, advanced emergency device. Option C, automatic energy defibrillator. Option D, automated emergency device. The correct answer is option A. AED delivers a shock to restore a normal heart rhythm in cardiac arrest. Automated external defibrillator. When should you use an AED? Option A, as soon as it's available for an unresponsive non-breathing person. Option B, only after 10 minutes of CPR. Option C, only for children. Option D, only if EMS arrives. The correct answer is option A. Early defibrillation significantly improves survival. What should you do before the AED delivers a shock? Option A, touch the patient. Option B, make sure no one is touching the victim. Option C, hold the AED. Option D, turn the victim. The correct answer is option B. Motion-free environment is essential for accurate rhythm analysis. Make sure no one is touching the patient, then use the AED. Can an AED be used on children? Option A, no. Option B, yes, with pediatric pads if available. Option C, only after 10 years old. Option D, only if unresponsive. The correct answer is option B, yes. Pediatric pads reduce the shock intensity for children under 8 years. What is the first thing to do when the AED arrives? Option A, turn it on. Option B, start compressions. Option C, check pulse. Option D, give breath. The correct answer is option A. Turning on the AED activates voice prompts and guide you step by step. Where should AED pads be placed on an adult? Option A, both on chest. Option B, upper right chest and lower left side. Option C, both on back. Option D, anywhere on torso. The correct answer is option B. Proper pad placement allows the shock to pass through the heart effectively. Can AED pads be placed over jewelry or implants? Option A, yes, doesn't matter. Option B, remove if possible. Option C, only for adults. Option D, only for children. The correct answer is option B, remove jewelry or medication patches to prevent interference. Should CPR be stopped when the AED is analyzing? Should CPR be stopped when the AED is analyzing? Option A, yes. Option B, no. The correct answer is option A, yes. Motion interferes with AED rhythm detection. Motion interferes with AED rhythm detection. What should you do after delivering a shock? Option A, stop CPR. Option B, resume CPR immediately for 2 months. Option C, check pulse. Option D, wait for AED. The correct answer is option B. Immediate CPR after shock maintains circulation until next analysis. Can an AED deliver multiple shocks? Option A, no. Option B, yes, as advised by AED. Option C, only once. Option D, only for children. The correct answer is option B. Automated external defibrillator may advise repeated shocks depending on heart rhythm. Can automated external defibrillator be used on a wet surface? Option A, yes. Option B, no. Move the victim to a dry area. The correct answer is option B. Water can interfere with AED operation and shock delivery. Should you remove clothing before placing AED pads? Option A, yes. Option B, no. Should you remove clothing before placing AED pads? The correct answer is option A, yes. Pads must contact bare skin for effective shock. Pads must contact bare skin for effective shock. What if the chest is hairy? Option A, shave quickly or press pads firmly. Option B, ignore. Option C, remove pads. Option D, use only one pad. The correct answer is option A. Hair can prevent proper and adhesion. How should AED pads be stored? Option A, any location. Option B, accessible and ready. Option C, locked in cupboard. Option D, with medication. The correct answer is option B. Quick access is crucial in emergencies. AED pad should be stored as accessible and ready. Can AED be used on someone with a pacemaker? Option A, no. Option B, yes. Place pads away from the pacemaker. The correct answer is option B. CPR and AED are safe. Avoid pad placement directly over devices. Should you touch the victim while the AED is delivering a shock? Option A, yes. Option B, no. The correct answer is option B, no. Contact could cause injury or prevent shock delivery. Contact could cause injury or prevent shock delivery. How many rescuers are ideal for using an automated external defibrillator? Option A, 1. Option B, 2 or more. The correct answer is option B, 2 or more. One can operate AED, another continues compressions, and teamwork improves efficiency. 2 or more rescuers needed. What should you do if the victim has a medication patch? Option A, leave it. Option B, remove and wipe area before placing AED pads. The correct answer is option B. Metal in patches can interfere with the shock delivery. Metal in patches can interfere shock delivery. When is it safe to use AED on children? Option A, always. Option B, only with pediatric pads. The correct answer is option B, only with pediatric pads. Pediatric pads ensure the shock is safe and effective. AED on children use only with pediatric pads. How does AED improve survival? Option A, it starts heart. Option B, delivers shock to restore rhythm. Option C, provide oxygen. Option D, clears airway. The correct answer is option B, deliver shock to restore rhythm. What should you do for a pregnant woman in cardiac arrest? Option A, perform CPR as usual. Tilt uterus to left. Option B, avoid compressions. Option C, only rescue breathe. Option D, call EMS first. Place a wedge under right hip to reduce pressure on vena cava. How do you perform CPR on a victim in a wheelchair? Option A, transfer to floor if possible. Option B, leave in chair. Option C, only compressions. Option D, only breaths. The correct answer is option A. Safe transfer improves effectiveness of compression. How do you perform CPR on victim with tracheostomy? Option A, seal mouth and nose. Option B, ventilate through stoma. Option C, only compressions. Option D, wait for EMS, emergency medical service. The correct answer is option B. Rescue breaths can be delivered via tracheostomy too. Should you perform CPR on someone with a DNR order? Option A, yes. Option B, no. The correct answer is option B, no. Respect legal DNA orders. Do not initiate CPR. Do not initiate CPR. How should you handle a victim with chest trauma? Option A, skip CPR. Option B, perform CPR gently. Option C, only give breaths. Option D, wait for EMS. The correct answer is option B, perform CPR gently. Life saving takes priority. Compress gently if possible. How should CPR be modified for a victim with chronic lung disease? Option B, no modification needed. Option B, skip breaths. Option C, only compressions. Option D, compress faster. The correct answer is option A. Standard CPR works, monitor for chest rise. No modification needed. What should you do if multiple people collapse? Option A, start CPR on everyone. B, prioritize who has no pulse. Option C, wait for EMS. Option D, only give breaths. The correct answer is option B. Try as the most critical victim first. How do you recognize cardiac arrest? Option A, chest pain only. Option B, unresponsive and not breathing normally. Option C, coughing. Option D, pale skin only. The correct answer is option B. Absence of unresponsiveness and normal breathing indicates cardiac arrest. Absence of responsiveness and normal breathing, sign of cardiac arrest. How can bystanders help if untrained? Option A, do nothing. Option B, call EMS and perform hand-only CPR. Option C, give medication. Option D, only use AED. The correct answer is option B, hands-only CPR improves survival even without training. How long can the brain survive without oxygen before damage occurs? Option A, 1 minute. Option B, 4 to 6 minutes. Option C, 10 minutes. Option D, 15 minutes. The correct answer is option B, 4 to 6 minutes. Brain damage begins within 4 to 6 minutes of oxygen deprivation. What is the best way to remember compression rate? Option A, 2 per second. Option B, music lie, Stalin ally. Option C, count to 30 slowly. Option D, 50 per minute. The correct answer is option B. Rhythm of a Stalin ally matches 100 to 120 compressions per minute. How do you help a choking adult who become unresponsive? Option A, give water. Option B, start CPR. Option C, abdominal thrust only. Option D, wait for EMS. The correct answer is option B, unresponsive choking victim requires CPR. How do you give chest compression safely to a frail adult? Option A, avoid compressions. Option B, compress to adequate depth, monitor response. Option C, only rescue breath. Option D, compress very tight. Compressions may cause injury but are necessary to save life. How do you manage a victim with suspected spinal injury? Option A, avoid moving, give CPR on back. Option B, move immediately. Option C, only rescue breaths. Option D, wait for EMS. The correct answer is option A. Maintain spine alignment while giving compressions. Avoid moving, give CPR on back. How should you handle a victim with a implanted defibrillator? Option A, do not touch. Option B, place AED pads away from device. Option C, avoid CPR. Option D, only give breaths. The correct answer is option B. CPR and AED are safe. Avoid direct pressure on implants. How do you help a drowning child? Option A, only compressions. Option B, give to rescue breaths first. Option C, start AED. Option D, give water. The correct answer is option B, give to rescue breaths first. Oxygen is priority in drowning cases. How often should CPR training be refreshed? Option A, every 2 years. Option B, every 5 years. Option C, once in lifetime. Option D, never. The correct answer is option A, every 2 years. Regular practice keeps skills current and effective. Which is more important if you are untrained? Option A, rescue breath. Option C, chest compression. Option C, check impulse. Option D, using AED only. The correct answer is option B, chest compression. Compressions alone significantly improve survival. Compressions alone significantly improve survival. What should you do if a child chest is too small for adult pads? Option A, place both pads on chest. Option B, use pediatric pads if available. Option C, skip AED. Option D, only compressions. The correct answer is option B. Pediatric pads deliver safe shock dose for children. What is the most important factor in CPR survival? Option A, fast breathing. Option B, early and effective compressions. Option C, use medication. Option D, waiting for EMS. The correct answer is option B. Immediate and effective CPR saves life. Timing is critical. Thank you.